The Honourable Member for giving way and pay tribute to the work that he does as the chair of the APPG on mesh. And he will be aware that when the MHRA appeared before the Public Petitions Committee in the Scottish Parliament, they admitted that their verification process for use of mesh implants amounted effectively to a 2-week desktop exercise carried out by 3 people at a cost of £20,000. And does he agree with me that that example fundamentally shows that the way in which MHRA are reviewing these devices as not fit for purpose is completely inadequate and actually, as we know from the work of that APPG, puts patients, and in the case of mesh implants, lots of women across the UK, at risk?
Honourable friend, who has also done excellent work on mesh as part of as co-chair of the group, is completely right. The regulatory system that we have in respect of devices, including mesh, is more akin to that which applies to toasters or plugs and the way in which they get kite marks than it is to medicines and the way in which they are approved. It's so problematic that last year the journalist I was talking about earlier on applied to get a kite mark, what's called a CE mark, for surgical mesh, except what they applied with was a bag used previously to keep oranges in, and they succeeded in getting a CE mark. Now that obviously wasn't put into a woman, but real mesh was and is put into thousands of women all over the world, those suffering with organ prolapse and SUI. And the real impact of that mesh has been revealed in the chronic pain, disability, indeed even death suffered by many of those women as the result of that mesh warping, breaking, morphing, changing in its constitution, cutting into organs in bodies. That only was revealed after years of sales.